Good morning, Dr. Velasco. We're a group of students from Valencia College. My name is Gary Ortiz.
Good morning, my name is Paola Gonzalez, and we have a few questions for you, Dr. Velasco.
I will be glad to answer your questions.
So the first thing that we want to know is, why do you choose this career?
Okay, health have been always important in my life, especially because I come from a family full of doctors. We have nurses, we have immunologists, we have pediatrics, and after watching them in their careers, none of that careers have really catch my attention until I met a close friend of my family. Since I met her, I think dental health is something really, really important, and it's something that it makes you feel better about yourself, especially your smile, because it's the best first impression that you can make to a person. That friend, she was really close to my family, and she was my dentist also. So I had the opportunity to go visit her dental office very often, and she used to like to explain to me all the procedures, like the whole process of the braces, how they change, how they affect your health. And she took 4 years in a dental school in Colombia, and she told me that it was really interesting, all the things that she had the opportunity to learn over there.
Oh, that's perfect. So, can you explain us your educational background, please?
Yeah, sure. So, 10 years ago, I took my first program at the Valencia College. It was the dental hygiene program. It's a small branch of the career of dentistry, and it's very general, but it's really interesting. So, I took 2 years, and after I graduate from there, I applied to the University of Florida in the dental program, where I took 4 years.
So the third question is, can you describe us your program on UF?
Yeah, so as I said, I took 4 years. The first 2 years you see more basic classes like biology, pharmacology, anatomy, and the second year you start to see more dental oriented science classes like oral anatomy, oral histology, oral pathology, and medical terminology. The third and the fourth year, you start to see more clinical work. You can see more the procedures and have yourself doing the procedures. Like you can see how you can mold the tooth, how you can remove a tooth. You can start practicing on patients. It's really interesting.
Oh, that's perfect. So, do you have any like difficult situation with a patient at work?
Yeah, one time I have a patient that she came with a really strong pain in her mouth in general. When I took her to x-rays, I see that she had a really bad infection in one tooth. So we have to remove the tooth and treat the infection by cleaning and and closing the cavity. She was in a lot of pain and she had a really bad bloating problem with that. So after the procedure, she started feeling better, and I had to prescribe her some antibiotics so the problem can get better.
So, Dr. Velasco, can you describe what are those Dr. Velasco, can you describe what are those instruments you have by your side?
Yeah. So these are like the more basic ones. This is the mirror. We can use it to reach some points that we could have some difficulties to see in the mouth inside, or it can help to give some light, reflect the light inside the mouth. And this is the scalator. We use it to cleaning process. We can remove the bacteria and all the dirty things that you can find in the mouth, or the rest of foods. They're the basic ones.
Thank you so much for your explanation.
You're welcome.